Hello everyone. Today we would like to give a presentation on security and privacy in mobile health solutions. This is done by me, Daksh Patel, and my colleague Vineet Yagnik. mHealth is a recent technology innovation in which mobile devices are utilized to support medicine and public health practices. It is a growing field that enables individuals to monitor their health status and facilitates the sharing of medical records with the physician and between the hospitals anytime and anywhere. This can also be done using the wearables and implants for those individuals who would like to monitor their health on their own. Moving next on, what is the importance of mobile health, and why is there so much so much research and everything going on this? Today, the monitoring mobile devices that were previously only available at hospital have reached the hands of the patients who were using them to monitor, manage, and communicate from home. mHealth aims to make healthcare accessible and cheap for everyone, especially in urban region, by making use of the remarkable smartphone penetration. For patients, they can manage their health needs with comfort at home, which reduces the visit to hospital and cost of the healthcare. For physicians, they can remotely monitor patients' health and can take care of them without performing physical meetings with them. The next topic is history of mobile health. Now, how did all of this begin? The mobile health industry could have not begun without the invention of the first cell phone. As early as 1949, AT&T began a program called Mobile Telephone Service, which was expanded to 100 towns and 5,000 customers in total. Since there was technology barrier in this particular program, like only 3 radio channels were available, which meant only 3 customers at a particular time could call in any city around the world. But as the time went on, mobile became a common gadget and various companies developed smartphones, which led to the creation of mobile health applications worldwide. This was just the beginning of creation of mobile health applications. The next, as and when technology comes up, the main problem occurs with the security and privacy of the data. This security and privacy of the data is described in this slide. The HIPAA, the Health Insurance Portability Accountability Act, security rule, which becomes effective on 2005, enforces administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and availability of electronic healthcare information that is stored or transferred electrically. The confidentiality. Most of the mHealth system collect data about a person's physiology, physical activity, or social behavior, and are designed to store the data for later analysis by caregivers and providers. Confidentiality violation could cause damage to the patients, since the attacker could use the eavesdrop health data in illegal activities. The data must remain confidential, subject to access control policy and mechanisms, and anonymous when used for research and public health purposes when an individual identities are not necessary. The integrity. Integrity stands for much of the information, whether psychological, behavior, or social collected by mHealth system, is sensitive and highly personal. mHealth system needs effective mechanism to secure stored data verifies that data has been altered by unauthorized party and verifies that the data was sent by the trusted party. The next in that is audit control. mHealth system needs to record and examine the activities of the system, for example, communicating with other sensor device worn on the skin or collect health-related information from the nearby sensors that, for example, sense contaminants in the air. Effective user authentication. The system needs to verify that the patient or physician has an identity he claims before accessing any sensitive information. Also, the system must be able to verify the user's identity to ensure that the collected data is posted to the correct health record and that any treatment applied is truly intended for the user. One solution is to build biometric sensing into the wearing device, such as bioimpedance approach taken by Corey Cornelis and his colleagues. The next is the access control. Access to the patient's health data could be requested by many users such as nurses, physician, insurance company, medical centers, etc. Therefore, effective and accurate access control mechanisms are required to restrict access to personal healthcare information. Data availability. The health data should be available to the patients and responsible entities such as physician at any time and from anywhere. For example, collected data from the user's electronic magnetic medical record known as EMR from the database in a hospital or from the cloud repository. The next is the freshness of the data. mHealth system is sensitive to time and depends on recent and accurate health data. Such data can help researcher better understand the cause of the complex human disease responsible for the death. Therefore, freshness of the psychological data and healthcare data is essential. Otherwise, mHealth system functionality could affect the patients negatively. Patient's consent. Patient's permission is critically needed in mHealth system whenever sharing of data with the external entities is required. The next topic is security threats. As and when the technology advances throughout the time, there are security threats that occur to a database or the personal information stored somewhere on the cloud. Now, how can these things happen? That is what we are describing in this slide. Electronic health information stored on mobile devices is vulnerable to wide ranges of security threats, which include: the first is malware infection. Malicious software may exploit vulnerability in an application or use social engineering techniques to trick the user and install itself on mobile device. The installed malicious software on the device could obtain the stored personal health information, damage it, alter it, or send it to untrusted entities. The second can be affected by application developers. In the case they don't take appropriate mechanism to ensure data security, attacks can exist in poorly implemented application, which opens the door for hackers to take advantage of the personal health information. The next is the mobile devices. The devices are vulnerable to unauthorized usage of the physical theft in case they unintended, which could lead to disclosure of health information or lack availability of medical application services, such as denial of services. Human users. In case they share the password of the device with others, an unauthorized user can consequently get an access to the phone. People use their smartphones for work, at the same time at house or a cafe for personal reasons. A recent study reported that about 41% of those who use smartphone in the health sector have no password protection on their phones. Furthermore, 53% admitted they have used unknown networks with their devices. Another scenario involves the users emailing personal health information to a wrong recipient rather than the correct one, leading to the revealing of the personal health information to unauthorized recipients. Health insurance company. Such companies may seek to gain advantage by learning health information which is not normally part of their review procedures. The last and the final one is data intelligence companies. Such companies accumulate and sell demographic information about the individual and their health conditions. So this were some of the security threats and how this may affect users' records, and how can a person get access to unauthorized access to the data which is stored on a database or on the cloud. From this slide onwards, my colleague Vinit Yagnik will take over. We'll discuss here some of the security attacks that happen on this mobile applications. Thank you.
Hello friends, my name is Vinit Yagnik, and the further topic on security and privacy in mobile health solutions will be explained by me. I'm going to talk about topics like security attacks, countermeasures, challenges, current scope, like current status of mHealth, future scope of mHealth. So now let's talk about security attacks. As these mHealth applications are very vulnerable to attack, so there are following attacks like eavesdropping. Now eavesdropping is divided into three categories. Eavesdropping on unencrypted internet, where information is sent over internet without encryption, and therefore intruder can eavesdrop and capture a message which contains personal health information. Here there is eavesdropping on locked sensitive health information. Here poor implemented mHealth applications may put sensitive user information into unsecured locations such as server logs, mobile applications, browser history. This action could lead to personal information violation. And third is eavesdropping on unencrypted SD card storage, where storage of unencrypted data files is done, for example audio files, from a sleep monitoring application on an external storage like an SD card. The SD card might be later accessed by unauthorized users. The other attacks are tampering with personal health data. An intruder may alter the personal health data that is recorded or reported by an mHealth application. The other attack is third-party attack. Here, the mHealth application may use or communicate with a third party, for example hosting services, social media based services, and share private information. This could lead to possible violations of privacy requirements. The other attacks are Bluetooth attacks. Here, the applications communicate with external devices like health sensors via Bluetooth. An attack called external device misbonding, that is DMP, exists for Bluetooth enabled devices that works on Android devices, which can allow external device to steal private data or inject fake data into original application. Other is application owner attacks. Some application owners may keep record of who has downloaded their application and hence reveal the user's medical history. Also, application owner may publish user reviews which accordingly can reveal who is using this application. The other attack is fake mHealth application, where the aim is to develop a fake mHealth application and collect personal information of the individuals. The other security concerns of the mHealth application are to be matched for the HIPAA requirements. For example, an intruder with physical access to smartphone may be able to extract XD card and access unprotected data, or delete the application or damage the phone and hence impact the availability of requirement. Security concerns while developing the mHealth applications are the developers may insert trackers into application to observe user behavior, which also lead to private data leakage. The other measures are smartphone owner's mistake. The owner of the smartphone may wittingly or unwittingly release data. Fake user consent. A malware may exist on a mobile device that is capable of executing scripted actions on the mobile as though the user generated or consent. Usually, user consent is required, and data may flow to understand untrusted application. A malware may take a role and generate response instead of authorized user. And the last is denial of service, that is DOS attack. mHealth monitoring applications usually needs to be continuously on, and attackers can float the network to stop the communication between application and external servers. Now let's talk about countermeasures for mobile health application. The suggested measures are Ubiquitous Health Trust Protocol, that is UHTP, which runs on an Android operating system. It contains 3 levels of authentication. The first is authentication of healthcare professional, second is authentication of device in use, and the third is authentication of environment access. For example, when a client wants to communicate with the server, he must first fulfill the 6 requirements, that is username, password, serial number of patient SIM card, international mobile equipment identity, that is IMEI number, longitude, latitude. The patient is allowed to communicate with the system if he is in the allowed location. The other is cross-platform mobile activity monitoring system on the cloud, where the suggested system incorporates with HTTP 2.0 with SPDY to enable fast and secure medical information pushed by server by individual users. The system consists over here of 4 parts, that is mobile, SPDY server, database for storing information, and MATLABs, which is used to analyze users' data. And the third one is reverse cloud approach. This is a new approach suggested which allows the transfer for the application to the mobile instead of sending data to be processed on a cloud. This ensures that the data never leaves the mobile application or mobile phone, and hence it is more secure. Other is applying encryption to the personal medical data stored on mobile devices and using TLS or SLL through the internet transmission session regardlessly the network transmission is encrypted or not. The other countermeasures are to be required better to meet the HIPAA security requirements again, such as restricting smartphone capabilities by removing unnecessary applications and preventing the user from installing malicious application, which will help in reducing the risk of a compromised smartphone. The other is perform both user and device authentication before allowing the health data to be stored into the server. The last is better feedback, which is used for the improvement of user feedback process in data transfer process and the data collection process. Now let's talk about challenges of this application. As such, this system is very wide range and it has a very big future for helping the patients' lives. So there are challenges like regulatory, that is many mobile devices need to be met with the regulations to become true tools for hospitals and practitioners to use. The first thing for the hospital and the providers need to know is the specific laws for the state and the states in which they are doing the business. This can include payment, medical board requirements, and prescription regulations. In some instances, mobile sensors or telehealth cannot be used with a patient until there has been one-on-one between doctor and patient. Also, companies that develop products that use mobile technology needs to be aware of whether what organization will have the oversight of products they create. The second is reimbursement. Well, hospitals and patients are very dependent on this application, but they are more dependent on the government bodies to make it more successful. Much like the regulations issues we saw, the reimbursement opportunity for mobile health are falling behind the demand. For example, the telehealth services are not necessarily reimbursed throughout Medicare without some specific criteria. This could be the patient and or the hospital is not located in a health professional shortage area, that is HPSA, or in a county that is outside of any metropolitan statistical area, that is MSA. The other challenge is, and I think so important, is security. The need to avoid HIPAA violations and keep patient information safe has only become more complicated because of the use of digital technology. A flaw in any mobile health application or telemedicine system will open a data stored on the device or in the app to hackers and malware. This in turn can open an entire health network up to a data breach. And last is IT support. Providers need to have a right personal IT staff, whether this is through the use of an internal team or an outside consultant, but it is still critical that a network in a hospital never goes down. The other important thing is the tech team can make moves on the fly to support devices and data flow in real time. Now let's talk about the advantages and disadvantages. First, the advantages of these mobile health applications is increase availability of social networks, increase independence of patients, reduce costs, improve efficiency of health services, improve patients' health condition. The main reason why mobile technology has been very popular to use in hospital is because it has improved many lives. A survey states that mobile technology has enabled physicians to frequently keep track of their patients, improve quality of healthcare, and enable patients to take care of their health easily. The disadvantages are digital device against patients, security issues as we talked about, lack of information control, safety and privacy. But the main issue with the mobile health technology is that it is challenging for health administrator to use mobile technology, that the hospital requires many privacy law. A survey states that 65% of companies are using software tools to block sites. However, 35% of companies are a lot of companies by the number that are not being strict on medical privacy, in which could lead to many problems for patients and their families. Now let's talk about the current status of mobile health solutions. A study is predicted that this technology is going to grow nearly $12 million by 2080. And currently, the wearable technology are making a major impact on healthcare field and mobile health movement. For instance, a Leaf system is a lightweight and wearable sensor that tracks patients' movement remotely. Also, because of the successful applications made, this system is in high demand. Now, the current status. Now, let's talk about the future scope of this technology. The future scope of this technology is very bright, and a study says that a global wearable computing market is predicted to reach nearly 35 billion by 2020, with an annual growth rate of more than 20%. Also, implementation of wearable technologies in this system is at high extent. So, as this technology is continuous in expanding over the coming years, both the smartphone and the wearable technology will make an impact on the healthcare system and improve patients' life across the nation. Also, these wearable technologies are expanding beyond the mobile health systems, and this device will link to the fields like military, industry, and fitness. So, I'm concluding my presentation, and I'm sure that me and my partner, Mr. Daksh Patel, were able to give you a good brief understanding on security and privacy in mobile health solutions.